everybody, to Sit Downs with City Lifestyle Vegas Edition. I'm Camila Soleil-Ray, and this is a new episode of our podcast. We have today a very special guest with us. His name is
Michael Fluhr.
And he works at Neuropathy Pain Centers of Las Vegas. Now, as you all know, I work with the best in class of local businesses, and Mike and Doc, they really run a tight ship. It's really a very special clinic, and I would like you to tell our followers, our viewers, what services can people find there?
Well, we specialize in pain management, but there's a lot of pain docs out there, and what makes us special is we harness different diagnostic tests to dive into the root problem and causes of your pain. We just don't treat the symptoms. So we have these one-of-a-kind tests that no other providers offer in the Valley to really understand, is your pain coming from your spine, outside your spine, and therefore we can do less things to get you better and start targeting the things that make the most sense for you. Okay. We offer these personalized non-surgical treatment solutions. So people come to pain docs and they think they're going to get needles all the time,
right,
or might get hurt.
Or they need surgery.
Correct. And we do our best to avoid surgery. We really do.
I love that. And I remember one of the times that I visited the clinic, you guys really do have these machines,
right,
that I had never seen before.
Correct.
Right?
Correct.
So what are some of the common complaints that people come with? And how many machines? Because you mentioned some different tests, right?
Correct.
So I don't want you to give your secrets out to the public, but I do want you to be a little more specific so people can understand how different you are and why they should look for neuropathy.
Absolutely.
Mm-hmm.
No, that's a great question. These machines we use mainly for neuropathy reversal.
What is neuropathy, Mike? Let's start with that, because I'm like, okay, what is neuropathy?
Neuropathy stems from many things, but a big common thing is diabetes. There's idiopathic, there's hereditary. There's a ton of type of neuropathies, but in short, your limbs, mainly your feet and lower legs, but sometimes even in your hands, the nerves, they don't get quite the blood supply that they need. Oh. So it starts with a circulatory issue, and that's where this machine gets your circulatory system back up to where it should be so it can feed the nerve root and you're not in pain. You know, some of the symptoms are numbing, tingling, burning. It depends. Some people, to their point, they can't even drive.
Wow.
It's terrible. But what we do is we get those nerve fibers healthy with electrical signaling treatment.
And so does the neuropathy can people be born with that, or does it have to come from an injury or like an illness, like you mentioned, diabetes?
Right. Well, that'd be more of a clinical question. I'm not, the doctor, but it mainly happens in the older generation. Like I said, diabetes is a big part of the neuropathy pie chart.
Okay.
And so it starts with poor diet, lack of exercise. So just a real quick change in your lifestyle and then getting some of this, these treatments really get you back on your feet and enjoy, you can enjoy life and doing what you do.
Okay. All right. And so what are some common complaints that people come with? Like, what are the top 10 or top 3, sorry?
Again, burning and numbness.
Tingling.
And even in your hands and whatnot.
Right.
But besides the neuropathy reversal, this machine also helps with frozen shoulder, drop foot, other sort of pelvic pain and whatnot. So it's completely minimally invasive. The only challenge is it's a commitment on the patient. You've got to get multiple treatments, and you got to be committed to getting better, to your own health. Mm-hmm. So we can only do so much,
right,
but the commitment is 2 to 3 times a week
for
30 minutes. So yeah, you really have to be invested in your health. And it's covered by most insurances. So we really see a lot of efficacy by doing this. And furthermore, Dr. Odell has published 10, maybe 15 times papers on this type of treatment. So the efficacy is out there. Doc has been published on there, and it's been in multiple medical journals. So it's not some voodoo weird treatment that you're going to get.
No, Dr. Odell is actually a graduate from Stanford, right?
Yeah, an MD, PhD from Stanford, anesthesia trained at UCLA, and then pain fellowship and trained by pain societies. But he's a double board certified physician in anesthesiology and pain management, world renowned for creating this neuropathy protocol. And he's the pioneer of of this. So
Wow.
that's really what makes us unique. We obviously treat acute, chronic pain, this pain, that pain, but he's really known for his work with neuropathy since it's such a difficult thing to dial in.
And so you mentioned that it's 2 to 3 times a week for 30 days?
No, for 20 to 30 treatments.
20 to 30 treatments.
Yes, and what makes us different is the people that do offer this mostly will charge you cash. And furthermore, you might get better in 10 treatments. It might take me 40 treatments. We're here to get you better, period. So we keep people in the system and get them in this protocol for as long as they need to. And of course, it doesn't heal everything. So there are other modalities that we use should the electrical cell signaling not work.
And what if the patient is not, for example, changing their lifestyle?
Then, in short, if the patient isn't complying with any medical office, the doctor typically discharges you. You have to be a good patient. That's your job, and your job is also to find a great doctor.
Right.
So it's a synergy, and we do all we can. Again, there's not a one fix-it-all thing for everything. So there are other modalities that are well known that other providers do: spinal cord stimulator, peripheral nerve stimulators. Even a capsaicin wrap called Qtenza for diabetic foot neuropathy.
Okay.
So there's a myriad of things that are possible should this non-invasive, non-surgical, treatment not work for you.
And you guys also work with stem cells, correct?
Yes, we do regenerative medicine. We use stem cells. We use exosomes. We harness your own body's healing power and do PRP. So really depending on the joint problems, which are mainly for joints, we'll choose which one's the right thing for you based on, is it a partial tear? Again, once we get the imaging, we look at your stuff under ultrasound, Dr. Odell makes a good decision as to what is the best product for you.
And so all the testing, the imaging is done in-house?
Yes. The only thing we send out if we need something deeper is for MRIs. But we do have an in-house x-ray machine, C-arm, and ultrasound machine.
Do you guys have chiropractors working there?
Not at the current moment. We did, but no, we don't, unfortunately.
So it's more really of not an adjustment kind of treatment. You really go to the root cause, like you said, because a lot of the times people think, oh, just a quick fix at the chiropractor will help me out.
Right. Manipulation's great, and there's a reason for chiropractors, and we had one in office, and it's a shame that they aren't there anymore because they actually got really big, and they're moving on to bigger and better things, which is great.
That's great, yeah.
But it was a modality that we actually liked having in the office because it was a balance between, us doing Western medicine and them doing more of the holistic thing. And there's a place for both in your treatment. So don't think chiropractic care is a fix-all or voodoo because it is great. There are some great chiropractors out there that do get people better.
For sure. But you mentioned that you do more Western medicine. When I heard you speak, I was really in awe of the novelty, right, that you guys use, like the machines and the root cause.
Right.
Instead of just treating, the problem.
Correct.
So going to the root cause, in my perspective, is more holistic because you're talking about lifestyle, you're talking about eating habits, you're talking about, other things that are involved.
Correct.
So I wouldn't really qualify what you guys do just as simple Western medicine, just because Doc is very innovative. He's always coming up with these solutions. We talked about that yesterday when I went to visit you guys, right?
Yes.
So that's, in my opinion, what makes you really different is the approach and the depth that you go.
Great. But it all starts with that approach. And again, that one unique test we do, it's a neural scan device.
Neuroscan. Okay, it's a neuroscan.
And it tests your sensory nerves. And that's when Doc really can determine, is it coming from your spine, which is essentially the trunk of the tree, or is it your peripheral nervous system, which are like the branches? So this completely dials it in.
Okay.
What level on the back we need to look at. So unlike other providers, they'll take shots, give you a bunch of injections in various parts of your spine, trying to locate your pain. We use nerve mapping to really dial it in and focus on that nerve root, or if it's not the nerve root, is it your disc height? But, again, we're the only office in the whole valley that uses this neural scan device, which is a sensory test with a wet Q-tip, and you just tell us if you feel this or not. So minimally invasive. He uses needles, but we prefer not to.
Okay.
Yeah.
Did he invent this neuroscan?
He co-invented it with Dr. Jim Hitchcock.
Oh, wow.
Yes. So it, like I said, it tells you if your pain is intraspinal or extraspinal. So again, one doc might give you an epidural steroid, and then the next time he's giving you nerve blocks.
He's
and
like,
you, and you
it's a
wonder why.
guessing
They're
game.
trying to figure it out.
They're guessing
right.
what's wrong with you,
We're
right?
going to guess without hurting you first, or putting a needle in you. And that's what, I pride our clinic on the most is, being thorough and diagnosing the patient.
It doesn't seem that you guess anything. You actually look for it where it is.
Correct.
With this neuroscan that he developed with someone else.
Correct.
Wow. How long ago did he develop this test?
It's been around since the late 90s.
Okay.
And then, of course, there's, reimbursement issues with, carriers like Medicare and whatnot. So it stopped getting the notoriety back then because it had challenges and whatnot. But the data that it shows where it corresponds with what level of the spine you're in pain and where to really focus the attention and then maybe get more imaging or do more things before we want to poke you. Because,
Right.
Doc truly doesn't want to poke you unless it's absolutely necessary. And if he does, he's doing his best for you to avoid surgery. So only in extreme cases do you truly, truly, truly need a surgery.
Yeah. And surgeries are always risky.
They are. They're costly. There's a lot of downtime.
Especially for like your feet, your lower limbs. You can't walk, right?
Yes. Yeah, no, there's a lot to it. So that's why we take this approach and do our best to get you better, instead of just farming it out to surgery, which is reimbursed and all this other stuff. So, we definitely look at the patient in a different way other providers do.
And I know you're not doc, and I know you're not an expert in medical, but
Right.
you've been with him for years.
Yeah, I've been with him since 2019. I was a former medical rep, so he was one of my accounts for 15 years, which is how I got to know him over time, doing a lot of cases with him. And, being in the procedure room with him, watching his hands and how gentle he is, gravitated towards me joining him after I put the medical sales behind me. So I'm excited about what the future holds. We're bringing on a new provider, Dr. Chester Westling, next week, who is primary care, but there's a lot of primary care stuff that marries up to pain management, diabetic foot exams, other type of things that sometimes your primary care doctor doesn't do until you tell them something's wrong.
Right.
So we're not trying to treat colds and some of the simple things your GP's doing, but there is a lot of things that marry up, especially with diabetic management and lifestyle changes.
So it's going to be a primary care that is aligned with pain management? Is that what I'm hearing?
Correct, especially with the diabetes management, because that's more primary care, but right now people are prescribing insulin or other drugs. Meanwhile, it's truly simple lifestyle changes. It really comes down to that. And the sooner you do it, the sooner you'll feel better.
And so since you've known Doc for so long, how did he get into this area, the neuropathy? Do you know that?
Well, again, he was anesthesia trained. And then in the late 90s, he went and did a lot of studying on pain management. There weren't pain fellowships back then. Now there's a ton. And after people go to residency, they go to fellowship and then they go into pain management. Well, Doc got trained by all these different societies out there and has been doing great ever since.
He's very passionate about what he does.
Very, very.
Yeah. And I know that you guys also hold an exclusive product over there in at the clinic that is to help people that leave the clinic decrease or eliminate their pain. And I've used that product. It's called Cure, correct?
Yes. That's a product that Dr. Odell and I developed. It's great for neuropathic pain, muscle soreness. It's not necessarily an all-in-one, but it's amazing what feedback we get from patients, how much it helps. So, besides you committing yourself to coming to the clinic so many times per week, we have these at-home treatment protocols that we suggest, a light pad. Again, if the Cure roll-on does better for your pain, or if your symptoms, if you start feeling bad, then, you can apply that, maybe avoid a Percocet or one of your pain medications. But yeah, no, the patients love it. They really do.
I love it. And really, so what Doc provides is a non-invasive approach to healing the
Correct.
pain and improving someone's lifestyle at the same time.
Yes, unless he has to go that extra mile.
Yeah. Well, that's
Correct.
his approach. And
Of course.
as a good doctor, if the last, resort is surgery or whatever, that's
Right.
what's going to happen,
that
right?
is
He's there to
unfortunate.
help the patient.
Absolutely.
Yeah.
Absolutely. He treats every patient like his own mother. So I call him a yo mama doc. And he's someone I would talk to or have my family go to. And you can't say that about all
You
providers,
can't.
especially
Oh,
when I
my
called on
God.
a lot of providers for
Yeah.
many years. They mainly treat you as what they're going to get reimbursed for.
That's so sad,
and
isn't
not
it, in our
more.
medical system nowadays?
It is. And I wish, Medicare and some of these other payers would not, go right to surgery and look at these other modalities and give these providers who truly want to help you the chance and the income to stay open,
Yeah, very good. So are there like 3 tidbits? Because I love to end each episode with practical tips that people can, and I know you're not a doctor, but
Right.
you've worked with him for a long time.
Right.
Disclosure, right? Disclosure, like those little lines. He is
Yes.
not a doctor, people.
No, not one bit. Not one bit.
But are there things that people can do to get help faster, earlier rather than later?
Truly, it comes down to you helping yourself. We have this program every Wednesday called Wellness Wednesdays.
Oh.
Yeah, on Channel 3. And we go over certain little tidbits on what you can do. So
Okay. What time of the day is that program?
it's at 3 p.m. It's right after the 2 o'clock news.
Okay.
So some of the things are just, get more rest. That's when everything grows. That's when your body tries to heal itself. Drink a lot of water, especially for your joints. You really, really, really want to be hydrated. So just really the simple things in life can help you because your body is an amazing thing and it can heal it. It heals
Yeah.
itself in
Yeah.
a lot of cases. But if you're putting a lot of inflammatory foods down and drinking a lot of Cokes and sugars and that stuff, you're doing yourself a disservice, especially if you are a pain patient or a neuropathy patient.
Right. So helping yourself
Yes.
is the first step.
Yes. We definitely want to, we coach the patient. And again, we take a total body approach, not just, oh, you have knee pain. Why do you have OA there? And what can we do to bring down that inflammation in your body?
Yeah, because once you correct the knee pain, then the neck pain is going to show up, and
Or
then
you
the
feel-
shoulder pain is going to show up.
Right.
Because, you try to compensate.
Of course.
Yeah.
Yeah. So a lot of patients do have multiple challenges, and if you have a bad knee, it's typically bilaterally, both bad knees. You know what I
Right.
mean?
Yeah.
Same thing with the hands or the neuropathy. It's typically in both limbs. So yeah, again, we want to take a more very conservative approach where you're healing yourself slowly through electricity and, some of these other supplements we recommend that are good for neuropathic pain. So yeah, we're getting great results.
Amazing. So tune in to Channel 3 every Wednesday, Wellness Wednesdays, with Dr. Odell. Yes. And any last words? Where is the clinic located? How can they find it?
Yeah, no, great question. We only have one location right now. It's centrally located, kind of. It's on 8084 West Sahara, which is Cimarron and Sahara. We're conveniently located on the first floor, and there's plenty of parking. One thing our patients love is the wait time is none.
Okay.
And we can get you in almost immediately. So if you are having challenges, give us a call and, we'll get you in tomorrow.
What's the phone number?
The phone number is 702-257-PAIN. So 702-257-7246.
Okay, very
Yeah.
good, Mike. Well, thank you so much
Thank
for
you.
being here representing Dr. Odell and Neuropathy Pain Centers of Las Vegas. It's an honor to have you guys with us, and let's keep on rocking and rolling.
My pleasure. Thank
Until next time, thank you for watching.